how anti-allergy medicines actually work, why some make you sleepy while others don't. Today we will explore H1 antihistamines, their types, uses and important clinical points you must know. H1 antihistamine are the drugs that act as competitive antagonists at H1 receptor, blocking the effect of histamine. H1 receptors are basically present on your brain, bronchi, blood vessels and on the skin where they can cause allergy easily. Now we have to talk about the classification that is based on the CNS penetration and anticholinergic effect into first generation and second generation. First generation antihistamine can cross blood-brain barrier causing sedation and psychomotor impairment. So they are contraindicated in drivers, machine operator or anything needing alertness. They also have anticholinergic effects such as dry mouth, blood vision, constipation and urinary retention. So the drug included in this class are highly sedating H1 antihistamine, moderately sedating and mildly sedating. Highly sedating examples are diphenhydramine, promethazine and hydroxyzine, where moderately sedating are phenethylamine and cyproheptadine, where mildly sedating are chlorpheniramine and clemastine. Now we have to talk about their uses. H1 on the basis of H1 blocking, they are used for allergy and insect bites. In the allergy, they are used for the urticaria, itching and hay fever. Now we have to talk their uses according to anticholinergic effects. So we can use it as for the motion sickness, common cold, Parkinsonism, acute dystonia. Other uses are it can be used as a drug of choice for idiopathic pruritus and for vertigo Cetirizine we are going to use. Their major side effects are sedation, impaired coordination and anticholinergic effect. Now the second generation antihistamine, they do not cross the blood-brain barrier, they cause little or no sedation and have no anticholinergic effect. They are safer for daily uses even in the drivers. There are some special features. Some drugs like Cetirizine and azilastine also have additional anti-allergic action. Important drugs, Terfenadine, that is the fastest acting, they can cause QT prolongation and torsade de pointes. Risk increase with drugs like ketoconazole and erythromycin. Loratadine is long acting and metabolized to disloratadine. Cetirizine is an active metabolite of hydroxyzine, while levocetirizine is its more potent and less sedating form. Olopatadine and alkafetadine are usually topically for eye allergy. So that's everything about H1 antihistamine, simple, high yield and exam ready. Don't forget to like, share and subscribe for more pharmacological videos.